This is Sarah Squires bringing you behind the headlines in today's edition of WYO Today Newsroom. Today I am joined in the studio by Dr. Scott Smith and Lindsey Anderson. They're from SageWest. Welcome to the show, guys.
Good morning, Sarah.
Thanks for having us.
Yeah, thank you. While we've got you here in the studio, I think, an important thing for us to kind of roll out here is this time of year. It is so important for individuals and families to sort of take stock of where they're at with their deductibles and their insurance and really make sure that they're getting the best bang for their buck when it comes to their health insurance. And I'm wondering if you guys can kind of give us a little bit of an in here on how the best way to go about doing that might be.
For sure. So this time of year, it's a good time to reflect on your health insurance. Perhaps you've had a year where you have maxed out your deductible for the year and they will reset come January. And so it's a great opportunity to think about some things that maybe you've been putting off or procedures that you feel like you probably need. And many times if you have met that maximum out of pocket, you can get things done with basically little to no expense or out-of-pocket expense. And so it's a great time to think about those wellness visits as well as procedures, maybe a knee or a shoulder, whatever the case may be, but also some of those preventative exams such as colonoscopies, mammograms, and those types of procedures.
Yeah, definitely. I've absolutely had those years where I wasn't thinking about this until it was sort of too late. And then I've got a really big, expensive thing, and it's mid-January, and I'm just kicking myself,
Right.
So now's a perfect time to sort of take stock and say, hey, where are we at? What do I need to have done? Now, Dr. Smith, can you kind of clue us in here on some of the maybe common procedures out there that are on people's to-do list that they should be thinking about right now?
Absolutely. So this time of year is exactly the time of year to start taking advantage of those paid off deductibles because this is part of your insurance, right? You pay into the premiums all of the time. And this is the opportunity for you once you've had the maximum out-of-pocket cost to be able to take advantage of it and do the things that need to be done. Certainly one of the things that we think about is screening. That's obviously an important piece of your wellness part of it. Colonoscopy is a screening technique that we use for detecting colon cancer early or even actually preventing colon cancer. And the advantage to colonoscopy over some of the non-invasive or non-procedural colon cancer screening opportunities is that it allows us to find polyps, which are the precursors to colon cancer, to remove those and be able to actually prevent colon cancer. So if you have a paid off deductible, this may be something that would be an opportunity that you might not choose otherwise. You might choose one of the stool-based studies, which is more of a reactive test. It tells you if there's a problem, but it doesn't allow you to prevent the problem. So colonoscopy is certainly one of those things. A lot of the things that we do in general surgery are not you don't have the luxury of choosing your time with that. But there are a number of things that you do. Those include maybe hernia surgeries. So, maybe you've had a hernia for some time that you've been putting off because of the out-of-pocket costs. This would be an opportunity to think about something like that. And we would urge patients, don't wait until the last minute to try to get in. Try to go ahead and get scheduled so that we can do the evaluation and then get things scheduled for the procedure, because those things just take a little bit of time, especially in the elective procedures. So we would encourage you, don't wait until the second week of December to try to make that happen, because it may not be able to be scheduled by that point. So this is the time of year really to be thinking about those things.
Yeah, absolutely. I have to think back to last month, which was Breast Cancer Awareness Month, and SageWest had walk-in Wednesdays, which, I think we were on here a few times, Lindsey, really encouraging people to check that off of their to-do list. And it sounds like it really went incredibly well.
It did.
Yeah, tell us about that.
So I'm still trying to get the numbers, but we definitely had over 60 women who participated in that. A couple in specific hadn't been screened for, I believe, around 20 years.
Wow.
Which is significant. And then some of the other ladies that we did help with that screening mammogram, again, same situation, maybe not 20 years, but it had been quite some time since they had a screening mammogram. So it was definitely needed and a worthwhile experience. And that's why we're here, for those types of situations, to help provide support and help make sure that women get some of those routine screenings taken care of. So just a great success. That's another one too, end of year. If you haven't had your mammogram done for this year, it's pretty simple. It's pretty quick. It usually takes less than an hour. You could even possibly do it on your lunch. And they're pretty quick to get you in. And that number for mammograms is 307-857-3463. Again, 307-857-3463. And you typically can get that mammogram scheduled within a couple days.
I would like to add to the importance of both of these techniques for screening is significant. Both of these techniques have been proven to improve survival from breast cancer and colon cancer. Colon cancer is the third leading cause of cancer in the United States, the second leading cause of cancer deaths. So, and we can certainly impact the survival, and we can impact the incidence of colon cancer, and the same with breast cancer. Maybe not impact the incidence, but we can impact the survival by early screening. Screening is an opportunity that allows us, especially in breast cancer, to be able to identify cancers at an earlier stage, which are more treatable. Of significant importance in this region is that the Native American population has the highest incidence of both colon cancer and breast cancer of all U.S. demographics. So very important in our area that we are very diligent about those screening techniques.
Absolutely. If you missed out on walk-in Wednesdays, it's not over yet. You still have time, and this is sort of the perfect time for you to kind of take a look at the things that you've been maybe putting off and say, you know what, I'm going to be able to get the best bang for my buck out of my insurance if I schedule these things now. So whether you've got a mammogram that's on your to-do list, a colon cancer screening, maybe you've got like a weird mole on your back that your wife's been saying, hey, buddy, you need to go to the doctor and get this thing checked out. You might be listening and thinking about your spouse or your parents, son or daughter, an important person in your life, something that's on that honey-do list, and it has to do with going to the doctor. Give them a poke here. This is a great time of year to be making sure that you're taking advantage of your health insurance. Nobody, wants to be kind of left in the dark and realize, hey, man, I really could have gotten this done a lot less expensively if I would have been smart about my timing. And so this is the time of the year for you to take a look at the things that you need to get done. For me, I need an MRI. I've had probably 10 MRIs in my life. They are no joke. Those things can be expensive, but if you think smart about it and you do it towards the end of your deductible, if you've already met your out-of-pocket maximum, you're not having to cough up, hundreds or even thousands of dollars for it. So now is the perfect time of year to be taking stock of what you've got to get done and get it on the calendar, get that appointment done. If you're looking for a mammogram, Lindsey here has the number. It's 307-857-3463. All right, guys. Yeah.
For sure. And if you're interested, Dr. Scott Smith works alongside Dr. Ben Roos, who's been on the show before. So both of them are general surgeons. We're blessed to have their expertise, and they practice at the Wind River Clinic in Riverton as well as Lander.
Oh, perfect.
And so if you do have questions, you can certainly call the clinic and get in contact with Dr. Smith and Dr. Roos. That number for the clinic is 307-857-3488. Again, 857-3488.
That's wonderful. So, Dr. Smith, can you tell us just a little bit about your background and kind of what brought you here?
Sure. I am a general surgeon. I trained in Alabama, did medical school and my general surgery residency in Alabama. And I actually moved to Montana in 2015 and have worked in rural surgery since that time. I have been very involved in providing high quality surgical care to rural communities. I spent 10 years in Lewistown, Montana before coming here. Some family transitions have brought this opportunity available for me now, and I look forward to being able to provide the same level of care in another rural community, another rural area that sometimes access to care can be a challenge for. And I think that's just something that I've become passionate about over the last 10 years is the importance of providing good quality care in rural areas. I think a lot of people have the impression that you have to go to a big city to get high quality medical care, and that's just truly not the case. There may be specialty care that is not provided in a rural area, but certainly you can find very high quality care, and I think SageWest in both Riverton and Lander provide that high quality care, and I'm excited about being a part of that.
Absolutely. Now, before we go here, I want to kind of put you both on the spot here and ask you to speak directly to folks here and offer up some advice as we're talking about this, talking about maybe taking a look at the things that you need to get done, the doctor's visits that you've been putting off. What is the best way to approach this topic with your whole family? What do you think, Lindsey?
So I'm sure Dr. Smith will have a much more technical, better answer than I will. I will compare it to a vehicle, which is really odd. But really, preventative maintenance is the key. If you hear that rattle, or if you feel like something's just not completely right with your body, or making sure that you are going in for those routine annual wellness exams, preventative is much easier than reactive or emergency. And that's the exact same with your body. So take care of your body. You only have one body. We tend to, be young and think that we are bulletproof, but the reality is just try and take care of yourself. Get into the doctor. It's much easier from their perspective to be able to help address and care for you on the preventative aspect, as well as getting to know you and what normal looks like.
Absolutely.
My answer would be early is always better. Right? If it is talking about treating a colon cancer, for example, colonoscopy actually allows us to prevent colon cancer in general, but even if there is a cancer that is there, the earlier we find that, the better. Your chances go up significantly with finding a cancer earlier. And maybe even a little less obvious would be something like a hernia repair. Earlier, again, is better, right? Our chances of giving you a successful hernia repair happen with an earlier repair than if we let the hernia become some enormous thing that then the success rate of the repair goes down. So I would just say that, again, don't put things off. Whenever you start to notice things or you are at the age for screening, go ahead and get those things done. I can personally attest, I'm up to date on my colon cancer screening. I know a lot of people have reservations about colonoscopy. It's not that bad. The prep the day before tends to be the worst part of it. The actual procedure itself is really a piece of cake. You take a very nice, pleasant nap. Procedure takes about 30 minutes, and you get a nice day of rest. So I would say it is 100% worth it to have the peace of mind to, first of all, know that you're okay, and to give you that 10-year period before your next colon cancer screening. So just act early and be preventative, just as Lindsey said.
Yeah. Well, nothing really does beat that, that relief when you've got, these things checked off your list, that sense of well-being that, hey, man, I got it done. And right now is the time when you can really take advantage of your deductible, make sure that you are getting the best bang for your buck when it comes to your health insurance, and an important time to take stock of what you need to get done and get those appointments on the calendar here with SageWest. Lindsey, before we go, can you shout out some of those numbers for folks who are listening and they want to take us up on this offer to get get checked out, take care of
Absolutely.
their health care.
Absolutely. So for Dr. Smith or Dr. Roos, general surgeons within our communities, you can call Wind River Clinic and schedule either in Riverton or Lander. That number is 307-857-3488. Again, 857-3488. Again, 857-3488. Or for the mammograms, you can schedule those with our central scheduling department, and that number is 307-857-3463.
That's fantastic, guys. Here's to wishing you a healthy end of your year here, and SageWest can help you deliver it. Thanks so much, guys.
Thank you.
Thank you, Sarah.